Assalamu alaikum, Dr. Maya here. Today in this video I will tell you the signs and symptoms of preterm labor. First we should know that what is preterm labor. Generally we start counting pregnancy from the first day of your last menstrual cycle till between 37 weeks of pregnancy to 42 weeks of pregnancy. Between 37 weeks of pregnancy to 42 weeks of pregnancy, the fetus or baby is called as a term baby. During this period, any time labor can start and baby can come out. But if the labor start before 37 weeks of pregnancy, we will call it as a preterm labor. Even if you experience labor at 36 weeks plus 6 days, it will call as preterm labor. And when you deliver such baby, it is called preterm delivery. When you're pregnant, your doctor give you a due date which is equal to 40 weeks of pregnancy because most of the pregnancies last around 40 weeks. Your doctor calculate your due date either by the first date of your last menstrual period or by the dating scan, which is the ultrasound which is performed during the first trimester, usually at 10 to 12 weeks of pregnancy. So roughly we can say that if you experience labor pains anytime after 20 to 24 weeks of pregnancy till 3 weeks before due date, mean before 37 weeks of pregnancy, it is called preterm labor. Now I will tell you the signs and symptoms of preterm labor. The first most important symptom of preterm labor is regular uterine contractions, and you will experience these regular uterine contractions either with or without pain. If you have uterine contractions without pain, you will feel like a tightening in your belly, right? So what is the important thing? You must feel regular uterine contractions and you must experience at least one in every 10 minutes. So regularity and frequency is very important. And with the passage of time, the intensity, frequency and duration should increase. What it mean? Mean if you are present at home and you are noticing that in every 10 minutes you experience one uterine contraction, right? So with the passage of time, you are feeling that in every 10 minutes now you are experiencing two uterine contractions. It means frequency is increasing. Number second, its duration should increase. Mean first uterine contraction lasts for 10 seconds, but now it is lasting for more than 15 seconds or 20 seconds. Mean duration is also increasing. And its intensity should also increase. Mean first it should be mild pain, then the intensity of pain should increase. So these are the characteristic properties of uterine contractions associated with preterm labor, right? So at least you should know that these contractions must be at least one in every 10 minutes and they should be regular. Because it is normal to experience uterine contractions during pregnancy, that is the false labor, and that are irregular and that will not occur one in every 10 minutes, right? Now, due to these contractions, the mouth of the uterus, that is the cervix, will start dilating. And due to these contractions, the fetal membranes can rupture. So due to the dilation of the cervix, the mucus plug can release. And due to the rupture of fetal membranes, there can be release of amniotic fluid. So you can experience increase or change in vaginal discharge. So increase or change in vaginal discharge is also a very important clue of preterm labor. Due to these uterine contractions, as the labor has been started, you can experience vaginal bleed, as during preterm labor your baby has to come out, so your baby will descend. And due to the descent of the baby, you can experience pelvic pressure and you can experience dull backache. So these are the signs and symptoms with logics. So if you are experiencing these signs and symptoms, you should consult your primary doctor, especially if you have a history of preterm labor or your ultrasound shows that you have a short cervix. I hope this video will be helpful for you. For more questions, you can ask in the comment box. Thanks.